and welcome to the ALCSI podcast, where we share the stories of lung cancer patients and their caregivers, as well as the work of doctors and researchers in the field. Today, we have the great honor and privilege of having Ronda Meckstroth with us. Ronda Meckstroth is a lung cancer caregiver and advocate who strives to raise awareness about early detection of lung cancer through screening. In 2015, her spouse of 23 years, Jeff, was diagnosed with stage 4 ALK-positive lung cancer, despite having never smoked. After pursuing eligibility in a second clinical trial for a fourth-generation targeted therapy, Jeff unfortunately passed away this past May. The medical challenges she experienced as a caregiver, particularly the lack of public and medical information regarding non-small cell lung cancer, biomarker testing, targeted therapies, and whole brain radiation, has inspired much of Rhonda's advocacy efforts now. As a board member of the White Ribbon Project, chief administrator of the ALK-positive patient support group, and leader of the ALK-positive Biden Cancer Initiative, she has made significant strides in the world of lung cancer awareness and outreach. Rhonda, we are so honored to have you on our podcast today. Thank you so much for your time and your willingness to share your and Jeff's story with us.
Thank you. I really appreciate the opportunity.
Awesome. Thank you so much, Rhonda. And to introduce our moderators today, my name is Priyanka Senthil.
My name is Medha Naga.
My name is Anish Guggilam, and we're with the American Lung Cancer Screening Initiative, a national 501c3 nonprofit working to raise awareness of lung cancer and lung cancer screening. So our first question for you, Rhonda, could you please share with us what your lung cancer journey has been like so far?
So I feel like our journey is a story about perseverance and like the power of love. And I like to say that in the beginning of Jeff's diagnosis, we had a lot of luck and a lot of chance in terms of getting to his diagnosis and being properly, tested and getting access to medications. We've had an 8-year, journey, as you said. It started in 2015. And I always like to be able to point out that there's just been incredible advances in lung cancer and testing, therapies, research. But it means nothing if patients and their families can't get access to it, or it's not utilized. And so we need to do better in that area, because I just don't think there's enough people that have had the opportunity that we got, somewhat by luck and by chance, and somewhat by just our perseverance. Jeff was a very incredibly athletic, busy person. He was a firefighter, paramedic, farmer, and just led a very healthy life. And he, as you stated, did not have any history with tobacco addiction. And so during an annual physical, he discussed having a non-productive cough, which led to a chest x-ray. And at the time, it happened to be during harvest. And so our long-term family physician and Jeff and I all agreed that we could wait to hold off to look into and wait to even see if after harvest things might be better. And I think it's interesting to note that none of us were thinking that this was something serious and that it could even be late stage, lung cancer.
Yeah, and you mentioned earlier that the journey to your husband's diagnosis involved a lot of luck and chance. So could you speak a little bit more about what it was like to receive Jeff's diagnosis and what was going through your mind at that time?
I like to describe it as a roller coaster. It's just, you're just flooded with emotion, shock, anger, fear. There was intense, pressure and burden, because we were so uneducated.
Yeah, thank you, Rhonda. And I can't imagine. I know you mentioned that you were not thinking that this was anything serious, and so to receive, such a big diagnosis with traditionally poor outcomes, I can't imagine how that must have been.
It did. It turned our life, upside down. We went from planning our future to planning, funeral arrangements. In the beginning, he was only given, months to live. So, it was a huge shock.
Right. And so in what ways did your life change after Jeff was diagnosed with lung cancer? Yeah, you mentioned, a change in perspective and outlook.
Well, I would like to, our world got a lot smaller, right? It's like you just become, you feel like you don't really like relate to like a lot of different people. And there are a lot of things that we had to adapt and change, about how we were living currently and what we needed to do to be, with just side effects from like the medications. And you just naturally, I think, kind of progress to not being as relatable to like your family, to your friends. And maybe you can't, stay out late as night. Maybe you're not, longer, partaking in, alcohol. You can't physically be, as active. So there's a lot of your world just gets a lot smaller. We definitely had to deal with like depression and fear, the mental health side. It's like, I think a lot of times people think about like with a cancer diagnosis and whatnot, you think about the physical aspects of what that does, but it doesn't really talk about, we don't talk enough about the mental health. And ironically, the fact that lung cancer research has gotten so much better, and you're having better quality of life, living longer, but that also means that you have a longer time period, where you have to really have a strong mental, right? Like to live 8 years, and people living even longer than that, you really have to focus on your mental health and stability in order to survive. But you really have to get to the point where you accept the diagnosis and you're grateful, for what, like we had a lot of things to be grateful for. And so, and you just we had to stop that mental process of where we were kind of stopped living, stopped making decisions, stopped making plans to, getting back to just trying to be as much as we could, Jeff and Rhonda, even if it was a newer version.
So, how did you balance the role of being a wife with being a caregiver? What were some of the challenges you faced along the way?
Today, I can say that my role as a caregiver was a must in order for me to even stay as a wife, and it's like it's not an easy role, and not every survivor or patient, has the advantage of having someone like me, a caregiver who wanted to step in and take that lead role of, diving into a language and research and learning about, Jeff's cancer and diagnosis. And so, we kind of early on, Jeff said, I'm not gonna look into that. I'm not gonna research. And so he's like, all I want to do is just focus on living and what time I have left. And then I always say, I focused on keeping him alive. Um, and so, I mean, I think the challenges were that we were incredibly undereducated. So not only about lung cancer, but about, all the, I never even heard of any discussions about, there was, I think we knew more about despair and related to lung cancer, not the hope, not the new treatments, not the testing, not the longer quality, of life. So we were incredibly undereducated. Again, I already spoke about that switch in, mentality. Um, I think the fact that we live in a rural, small community, that was another huge challenge. And so there was great burden on me as a caregiver to immerse myself in this world, and quickly realizing that not all cancer centers are equal, not all doctors, all oncologists, medical teams have the same access, have the same knowledge. And that's something that, you until you're immersed in that, you don't really know the differences in, the types of what you may have access to in like your hometown or what's closest by.
And over your and Jeff's 8-year journey with lung cancer, there must have been a huge learning curve of a lot of different things that you learned about as a caregiver. So how did your role as a caregiver change over time, and how did you figure out how to best support your husband?
Well, I learned about I joined a support group, which helped me that's where I gained a lot of the initial education. And I think that learning, the biggest difference became when I was able to connect with and build and grow our medical team, right? Like we brought on a specialist, Dr. Alice Shaw from Boston, Mass General. And that was a game changer for us in regard to now we were able to do local, but also connect with somebody who was immersed in the knowledge and the language and the research. And it took a great burden, off of Jeff and I as well, because now we knew I didn't have to, continue to be as, um, I guess, as knowledge and keep immersing myself as deep. And so I was able to feel like I had somebody else that was going to be able to help fight for Jeff to be able to get the proper treatment. I think that recognizing we had to have conversations too about the fact of what he may want, as the survivor, as the patient, and what I want as the caregiver, that we may have times where we're not going to be on the same page. And so we did have to have those early tough conversations about what was important to Jeff, about, his quality of life, not just about the length of life. And, just having those like tough discussions. And ultimately me realizing that at the end of the day, it was his, I could get him the information, we could have a discussion, but it was his decision. And so I really wanted to, that those were important discussions. And it was something that we always, kept in, in the forefront in terms of, and then I said it before, but really bridging that distance, that gap between being sad and depressed and fearful and anxious to, okay, we've got this opportunity with these targeted therapies and your diagnosis to be able to actually live with lung cancer. And so we just flipped the script, and we stopped focusing so much on death and started just focusing on living and acceptance and being grateful for every moment.
And you shared with us that you and Jeff weren't provided with a lot of information from the hospital regarding lung cancer following the diagnosis. And so how did you end up finding this information and being able to immerse yourself in the language and knowledge of lung cancer? Because it's likely, very foreign for anyone who hasn't needed to do this already.
Definitely. I would say the biggest game changer was in my, you start out with Google, right? You're Googling and asking the questions, lung cancer, ALK positive. A lot of that language is incredibly difficult. So I obviously needed to find a dumbed down version. And I ended up coming across, an online support group. It was very narrowed. It was very specific. And, lung cancer doesn't discriminate. So when you join, a group of, I think when I first initially grouped, there were probably close to 1,000, now we have, several thousand, but that's worldwide. And when I say it doesn't discriminate, we have people in the group that are professors, that are, radiologists, physicians, nurses, work in health insurance. So you just have this right? So it's like we're all learning from each other's, experiences, whether or not they're good or whether or not they were negative. You're still always learning, and you have these people that are part of the support group, that are willing to share from, their perspective. And so that was my first real introduction, just learning from all those people who actually were living the same life Jeff and I were. And then I think when I started to really realize that Jeff's care was not following what should be done, that is when I, with my research, found an email address for Dr. Alice Shaw, and actually just wrote a desperate email that she responded to. So, I feel like that support group was, our lifeline.
So, in particular, you shared that the tumor board recommended that Jeff receive whole brain radiation, but you had read about another targeted therapy that crosses the blood-brain barrier, which the tumor board, was not aware of. And within a few weeks, the 8 tumors in Jeff's brain were gone following the medication treatment. Could you share with our listeners a little bit more about this story?
Right. So the first year that Jeff was on a targeted therapy, that was the first generation targeted therapy at the time. And in that first year, Jeff did not have any cancer in the brain when he was diagnosed, but unfortunately, that first line therapy did not cross the blood-brain barrier. And so Jeff did end up developing in the brain. And to be real truthful, he did have a baseline MRI when he was diagnosed, but nobody was really tracking it or following it in that first year. And that was another thing that I learned on the group, was that, this cancer likes to travel to the brain. The medication Jeff is on doesn't do as well in the brain, and we really should be monitoring. And I can remember talking with our oncologist at the time about the fact that, Jeff should be, having MRIs of his brain. And it was an uncomfortable conversation. He said, that it wasn't necessary. Jeff didn't have any symptoms. And I can remember, and like, we've never even had that discussion. I don't even know what the symptoms would be. So how, and I can just remember pleading and begging with him to just include Jeff's brain in his next set of body scans, which would be just a CT, not the brain MRI. And this is where another one of those luck chance comes in, because the CT of the chest, when they included the brain, caught one of the 8 tumors. It was large enough that it did show up on the CT scan. And we got a call that night that we needed to come to the cancer center the next morning. They did do an MRI, and instead of there being 1, there were 8. And this is when I was clearly able now to prove to Jeff that where we are in our local rural community and their knowledge level of lung cancer was not sufficient. And I can remember at that time, that's when I wrote the desperate email, and I knew that there was already now a second line of therapy that did cross that blood-brain barrier. Dr. Shaw agreed to look at, Jeff's scans, and because he didn't have any symptoms, and she felt that we, had caught it early, that he could just switch to a second line therapy, which he did. And no, we did not need to go through whole brain radiation. And like I said, in weeks, that did clear his brain, and he never had any more brain metastasis after that time period. And when you're wanting to have a good quality of life, when you expect to live longer with these, newer advances in these therapies, the last thing that you want to do is actually have a treatment that might end up impacting both of those things, especially if it's not necessary.
And Do you worry about how many families are out there that didn't receive the best treatment because they didn't know about all the treatment options?
Definitely. I would say that that's one of the main reasons why I wanted to speak out and even become an advocate. And I think that most of the time, I credit the fact of being part of this support group allowed me to recognize not only back in 2015, but still today, it keeps me so grounded in knowing that there are so many people like us. We're not a rare story. We're not the only ones that have luck and chance. Um, and there are a lot of people, like I said, that I read about. I read their stories, I talk to them, that they even, like I said, they may not have somebody like me who's willing to jump in and learn. Maybe they don't feel like, oh, gosh, I can't write an email to a leading, oncologist. We can't travel, to Boston. Um, so yeah, it's like I don't have to wonder. I know because I've talked with so many people and I read their stories, and sadly, it's still going on. Where you live and who you choose to go to, for treatment, makes a significant impact on whether or not you get access and treated properly.
Yeah, thank you for sharing, Rhonda. We haven't heard this perspective in our previous podcast, so I think it's really, really valuable to share with our listeners. And it is really frustrating that a lot of the burden around lung cancer and lung cancer screening falls on the patient and their family. And even with lung cancer screening right now, a lot of individuals who have gotten screened that we've had the chance to have on our podcast have told us that, they went to their doctor asking to get, lung cancer screening because, they had some symptoms, they were feeling off, and they knew something was wrong. And they thought that lung cancer screening would be helpful. And especially for individuals who don't have a smoking history or don't have, significant symptoms, for a lot of doctors, and for the families, lung cancer is not on their radar, but the burden of, bringing information about lung cancer screening to their doctor, and also reading about lung cancer, the treatments, and needing to become familiar with all the language really does still fall on the patient and their family, and there isn't as much resource and support as there is for other cancers. So I definitely think is an area that we really need to work on. And you also shared with us that you tested your home for radon and found high levels of radon, which is leading you to believe that potentially radon may have caused Jeff's lung cancer. Mm-hmm. And so radon is still not very known or talked about within the community. And so how do we increase the education around radon and lung cancer, and especially in areas in the US where the radon mm-hmm. levels are high? How can we get communities to support individuals in being able to test their home for radon?
I think it's along with your guys's efforts like yours with the grassroots movements for the importance of lung cancer screening, large scale public health campaigns to discuss these additional risks for lung cancer is so necessary. And radon is the second leading cause of it. So I think we live in the textbook classic home. Our home was built in the 1800s. It's an old country home. We have a limestone basement. We live in a rural community in Ohio that is, when you look, there are geographical areas and maps that are already well known about where these risks are higher. I think the fact that we didn't even know that about radon. It's a simple test for radon. It's very inexpensive to do, and not only that, but the mitigation is very, to do our whole entire home, the mitigation process was I think it was only like $1,200, to remove the gases, from our home. And so I don't understand why it's not, why it's not required. Like if you're going to be like purchasing a home, maybe it needs to be, a discussion. And I just think that, states, especially like that have, that are known for like these risks, we need to just do a much greater job of making people aware of that this is something that you can simply test for and easily mitigate.
Absolutely. And so Rhonda, another one of the biggest things that we like to talk about on the podcast is the stigma built around lung cancer, and many people having the misconception that only individuals that smoke can get lung cancer. Did you or Jeff throughout your journey ever experience any of the stigma? And how do you think we can best begin to break down the stigma around lung cancer?
I love this question. I love this question for a lot of reasons. And I would say that since 2015, my thought process on this has grown and has progressed. Initially, I think that I would say that Jeff and I would commonly get asked whether or not, oh, you have stage 4 lung cancer. Oh, I didn't know Jeff smoked. Or if you're going into a medical, appointment, the questionnaire is there, or you might get asked in the appointment about whether or not, Jeff had, a smoking, history. But, I look at that today as the fact of that that question gets asked whether or not, right? Like even if you were to go into the doctor today, you're going to fill out a questionnaire that's going to ask what that history is. And I also feel like it's not, a stigma is a learned behavior. And so one of the interesting things is that when we first started filling out those questionnaires, I would mark no under no tobacco, history. And then Jeff said to me once, would you actually write that I never had any history with tobacco? And then that led us to have this conversation in the waiting room. I'm like, why is that important to you? Why do you want me to write in, like not just check mark no, but write never? Why do you feel that? And he said to me, I don't want them to blame me, for my cancer. And then that just led my research brain to say, I never had any history, neither did my family, neither did Jeff, neither did Jeff's family. And where do we get this? Why do we feel this? How do we know this? And why do we feel this shame? And I just found that so fascinating that we had no exposure to it, and yet we felt this shame. No exposure meaning like no tobacco history, but yet we knew, right? We'd been taught since we were, in you as a youth, in school, public health, campaigns, highly successful public health campaigns that have taught us all to have this behavior, to associate negative thoughts about lung cancer itself, about those who suffer from tobacco addiction. And it's still going on today. It's like we apply, we have no compassion. We have there's the public health education has completely failed in terms of giving the full story of lung cancer. We've told it in a way that makes those who suffer with tobacco addiction feel responsible, to not only feel responsible, but also to feel guilty and shameful, and like that they've brought it on themselves and that they aren't worthy of screening, of treatments, of, it's just, And we've never updated and told the story of hope, of all these new advances. It's sad, really, when you think that the majority of people, you can walk out on the street today and you can ask them what they know about lung cancer, and every person is going to tell you that they know that it's associated with a tobacco addiction or with smoking. Um, and yet they won't know any other story. And so I really blame public health for teaching us the learned behaviors about what we know and what we think of people who suffer from tobacco addiction. And I think now when I advocate, I changed my language. I frame it in the sense of those who suffer from tobacco addiction. And you can see that public health gives grace to a lot of other people who suffer with, addictions. And we don't give that grace, to those people who clearly suffer from the tobacco industry. And so I think that we've learned this behavior, and it's a very successful campaign. And when you say public health is everyone, right? That's your medical teams, that's your families, your communities, your educational institutions, right? It's like I don't understand why we haven't progressed, that we haven't changed how we promote it, and we haven't changed the education level. And we have to, the public health organizations, those big ones, the CDC, American Cancer Society, American Lung, like I call them out. They need to educate us all better on what has changed, what has updated, and we need to have compassion and empathy for the largest risk associated with lung cancer.
Thank you for sharing that. And I really love the way that you worded that public health education has failed us, because it's really true that a lot of these campaigns have been telling us that smoking is a choice and that smoking causes lung cancer. But in truth, smoking is an addiction that sometimes causes lung cancer, but really there are so many other risk factors, and we can't be blaming lung cancer patients for their own diagnoses.
No.
And yeah, and you mentioned that as an advocate, you were changing the language that you use when addressing people's smoking histories. You were using the words tobacco addiction. So our next few questions relate to your advocacy efforts. Firstly, you play a pivotal role in the White Ribbon Project as one of the board members. So could you share a little bit more about the work that you do with this organization?
Sure. I connected to this organization because of the story. The story, I think, aligns exactly with what we were just talking about. So the White Ribbon Project, I know you guys work very closely with them, but, was started by Pierre and Heidi Onda. Pierre is a family physician in Denver, Colorado. His wife is a public health educator, fitness, enthusiast. They were both highly educated, and neither of them knew that Heidi was capable of, getting lung cancer. And so I think that their story, you can't have any more education, right, than to have a master's degree in public health and be a family physician, and yet you were blindsided, by this diagnosis. So I think, their story really resonated with me. And I think because I struggled as being recognized as a caregiver, it also resonated with me to see the two of them together, right? To see that image of the patient, the survivor, and the caregiver, and that struggle, that journey that you travel, together. So it's like I loved their message of they gravitated towards things that a lot of advocacy organizations don't do. I love the fact that they wanted to dive into lung cancer screening. And I see this as full circle, because lung cancer, the more people we can get screened, the more people we can find, the more people, there's going to be more pressure for better public health. There's going to be more pressure for funding. There's going to be more pressure for research, right? It's like they go, hand in hand. And for my joining the board and working for them was basically just out of love for what they stood for, and I thought that they represented a lot of what was needed in lung cancer advocacy. And my strengths came from more in communication. So I helped them with building their website, some of their social media communication. And I think maybe just bringing another caregiver voice and maybe some history, since I had been, in this advocacy and immersed in lung cancer, a little bit longer than what they had. So
thank you for sharing, Rhonda. It truly has been really inspiring to be able to work with the White Ribbon Project. We've had the opportunity to do several White Ribbon builds across the U.S. and we're planning a couple more for this fall. But it's always so inspiring and energizing to be able to have these builds, and the builds are central to the White Ribbon Project's mission of just connecting lung cancer patients together, regardless of their diagnosis. There are and now a lot of support groups specifically for patients with certain genetic mutations like the EGFR or ALCA, and I think those support groups are wonderful, and those organizations are really wonderful in terms of connecting patients with other patients who have a very similar diagnosis. But I think the White Ribbon Project is unique in that it connects all patients regardless of whether they have a specific genetic mutation or whether they're rallying for more funding for lung cancer or increasing lung cancer screening rates. Just kind of brings everyone together, not just patients, but doctors, caregivers, students, anyone who really cares for the cause. And I think that's what makes it so special.
Right. And so on such a personal level, right? It's not just about attending a meeting or a conference or a summit, right? It's there's something just very spiritual, very about those builds, that just it's something that's missing from all of those other elements, that just I think it's the perfect symbolism of what's needed in the growth in lung cancer advocacy is just having a community. I think watching people come on and share about what it was like, because we're told, right? We're told as people who have lung cancer that the public doesn't support you, the public blames you, which really isn't true. And I love these ribbon builds and people who go and reach out to their communities, right? Their Home Depots who might help, supply the materials, their local, athletic teams, or you see them come on and say, oh gosh, our community rallied around us, they supported us, they helped us, build their so I also love lung cancer people being able to feel the love of their community, because we're just kind of told that the public doesn't support us, and I don't think that's true, and that's what I love about these builds.
Right. Absolutely. And Rhonda, could you tell us a little bit more about your work as the Chief Administrator of the ALK Positive Patient Support Group? You talked a lot about how that particular support group really helped you and Jeff throughout your journey. And so we'd love to hear about your role now in the support group, and maybe how it's changed as well since when you and Jeff joined.
Sure. And this organization was also started by another married couple. Tom and Marita Carroll was their name. They were based out of Alabama. She was the one who was diagnosed with ALK-positive lung cancer, and they were on a line in support groups, but they were very broad. And she wanted to be able to connect with and actually have conversation with people that had the same type of lung cancer as her. And so she decided to create this online support group that was specific to caregivers and survivors, patients with ALK-positive lung cancer. And when I found this group, gosh, back then there was probably maybe around 500 people maybe a little less, that were part of this group. Today, there's probably close to 5,000. And but I really was able to connect with this couple that started this group, and it was really through watching him as a caregiver and him taking the lead role in like his wife's care that really inspired me to think, I can do this too. And so he really kind of set me on that path and on the journey to taking a lead role, in Jeff's care. And when his wife passed, there became a time period where he no longer wanted to, continue on with being leading this support group. And I think he recognized my passion, my respect, and my strong desire to want to be able to help others and to be able to pay back, because I felt like this group saved Jeff's life and allowed us to learn about how we could live with lung cancer. And so it just became real important to me to want to be able to continue this legacy and to help others and to pay back. And I'm incredibly thankful for this organization, and it's something that I feel equally as committed and a great love for. And so we have a team. We have about 4 or 5 of us that actually help administer this support group and our goal really is just about answering people's day-to-day questions, and getting them to tell their stories. And so I feel like that allows me to always stay grounded in not my own journey, but in lung cancer as a whole. Yeah.
Awesome. So again, it truly has been a pleasure and honor to talk to you, Rhonda, and learn from the wealth of knowledge and experience you have in the area of lung cancer advocacy. We truly appreciate all the work that you're doing. And thank you to our listeners for joining us on this episode of the ALCSI podcast. We hope you enjoyed it. Please keep an eye out for our upcoming podcasts and events, which will be listed on our website, www.alcsci.org. Thank you and have a great day, everyone.